Hi everyone, thank you for joining us for On Call for All Kids. Today we're talking about hip dysplasia in babies. We'll be discussing who is at risk for hip dysplasia, what causes this condition, and how to treat and possibly prevent hip dysplasia. I am joined by pediatric orthopedic surgeon Dr. Drew Warnick here at Johns Hopkins All Children's Hospital, and it's great to have you here.
Oh, thank you.
So what is developmental hip dysplasia?
So developmental hip dysplasia is an abnormal development of the hip that results in a very shallow hip socket. Now the hip has a ball and socket joint, and if this socket is very shallow, that can lead to subluxation or dislocation of the hip that can lead to early hip degeneration.
Who's at risk for getting this?
So it's a very common problem in newborns, and you're at risk. The most common thing is if you're firstborn. You're at risk if you're female. You're at risk if you have a family history of hip disorders, and you're at risk if during pregnancy the mother has oligohydramnios, which is a condition where there is not enough fluid in the womb for the baby.
Okay. And what actually causes it? Is there anything we can prevent?
So the causes are many different causes. One is going to be the ligamentous laxity. So if the joint is very ligamentously lax, it can lead to this hip coming out of the socket. The number two thing is this position of the baby in the womb. If they're in a breech position, a lot of times that hip is in a very abnormal position, and the hip is getting pushed out the back of the socket, and that can lead to abnormal development. And the third thing would be positioning of the newborn after they're born, such as if they're swaddled incorrectly.
Ah, well, will you show us how to correctly swaddle our babies?
Yes. So the appropriate way to swaddle the baby is we're taking one edge, we're folding it over, then we're putting at shoulder level, the baby's chest up, and then we're crossing the arms, and this mimics the natural position in the womb. Then we're taking the left side, we're coming over the shoulders, we're tucking this in to keep the arms secure. Then we're taking the bottom edge, and we're folding it upward, and it's important not to go past the shoulders because we don't want to cause any thing that can interfere with the child's breathing. And then we're taking the other corner and folding it over and tucking it. But what's the most important thing for the hips is that we allow enough motion for the hips to freely move inside the swaddle. If this is too tight, that can push the hips out of the socket and lead to hip dysplasia. So we want to make sure that there's enough space in there for the baby.
So really tight enough that they feel secure and they're cozy, but loose enough that they have a little bit of range of motion.
Exactly.
Okay. So how do we know if our child does have hip dysplasia? Are there signs or symptoms that we should be looking for?
So it's very difficult to know because hip dysplasia does not cause pain in the child. And so usually this is going to be diagnosed by your pediatrician who's regularly doing physical exam of the hip joints on your routine follow-up visits. And the other thing is, if you have any risk factors that we talked about earlier, an ultrasound is recommended to look inside the hip to make sure that there's no dysplasia in the hip.
Okay, so say that they are diagnosed with hip dysplasia, or they come here to you to get that referral appointment. What's the treatment then for this?
So the treatment is a special harness called a PAVIC harness, and we place the baby into the harness. We're carefully putting the arms in. And then what we're doing is we're putting the feet into this harness, and this positions the hip appropriately for good hip development. So once these legs are in, what the brace does is it keeps the hips, these straps keep the hips flexed and abducted slightly, so that's the good position for hip development.
So Dr. Warnick, how long are they in this harness for? Is it uncomfortable for the babies? How do the parents react to this?
It's typically not uncomfortable for the baby, but it is annoying for the family because it's difficult to keep the baby clean. So because we're in this all the time for about 2 to 3 months.
After that, is there a repeat MRI done to see if it's healed, so to say?
Yes, so we follow up with repeat ultrasounds and x-rays later on to make sure that the hips are developing appropriately. All
right, Dr. Warnick, thank you so much for joining us. If you have any topics you would like us to cover, you can comment below on this video, and don't forget to check out our website. It's HopkinsAllChildren's.org/newsroom, and we have a lot of pediatric healthcare information there as well. Thanks for watching. We'll see you next week.